Thank you for tuning in to Ask the Therapist. I'm going to talk about bipolar disorder. There's a bipolar 1, a bipolar 2. I'm going to give you some very basic general information about bipolar disorder. Remember, this information is not meant as a diagnosis, but for informational purposes, for you to check further either with a counselor like I am, a psychologist like I am, a psychiatrist who is a medical practitioner, or your medical doctor. Or if you think you are experiencing any of these disorders that I described on Ask a Therapist. Okay, so we're going to talk about bipolar disorder. Bipolar disorder is very common. Many of today's celebrities and movie stars and politicians are informing us that they suffer with a bipolar disorder. Now, a bipolar disorder means you going from one extreme to the other. There's either the manic, very happy, excited, or depressive, you're very down. A bipolar disorder is characterized by one or two episodes of manic behavior. What is manic behavior? Excited, anxious, excessively happy, loud, moving around a lot. And then that is followed by, well, that manic state needs to last for at least a week or less. And the person moves into almost immediately into a depressive state. They are lethargic, they are just down, very slow movement, sometimes a slur in their talking. That's a bipolar disorder. You go from one extreme, the manic end, to the depressive end, which is the lower end. You're from highs to low with no apparent reason for either one of them. It's just the way it happens for them. If you have a person who is experiencing those behaviors, it is important, it is very valuable to you and to them for you to have them seen by first a medical doctor, because it just might be that they need a medication that will even them out. If you are not prone to want to desire to take a medication but want to continue exploring, and I always get a second opinion on everything that anyone tells you, because you can always today find so many different alternative medicines that can help you in situations. So bipolar disorder, a person has to have been in the manic, very high state with a week or less, and then start experiencing the low, depressed, lethargic state, and in this disorder. Thank you for tuning in to Ask the Therapist. Bye-bye.